It had been widely believed that babies will not remember pain and therefore will not develop post-traumatic disturbances. The medical establishment shared this delusion until 1987, when it was shown to be false by a heroic scholar, Dr. K.J.S. Anand, who published his definitive studies in the New England Journal of Medicine. Before that, newborns and infants up to 18 months of age were operated on without anesthesia. As a consequence, anyone who had such surgery is at risk for chronic post-traumatic illness.
Abdominal surgery for pyloric stenosis and chest surgery for congenital heart problems are the most common forms of infant surgery. Together, these surgeries are required for about 8 cases per 1,000 births. A rough estimate of the number of survivors during a single year is over 30,000. We do not know how many of these survivors now suffer with post-traumatic symptoms. Infant surgery without anesthesia is a glaring example of preverbal trauma, but there are many other traumas during infancy. Birth in the hospital can be traumatic if the delivery was complicated or the baby could not be held by the mother in the delivery room. Babies in pediatric intensive care units are subject to many painful experiences, such as injections, chest tubes, and breathing tubes. Aside from the hospital, trauma threatens infants in many ways. Accidental injuries, concussions, illnesses, maltreatment, and the witnessing of violence are all sources of trauma. People who have survived these early experiences usually cannot recall them verbally, while they cannot forget them non-verbally. They may live lives of quiet desperation, reacting to every stress with a silent scream.
We know today that infants feel pain and they remember the pain. That memory is not verbally coded and therefore is not conscious. It has not been mitigated by time or by life experience. It festers in the nonverbal mind and threatens to overwhelm the person. The post-traumatic syndrome of infant trauma is not generally recognized. There are individual therapists using medical hypnosis that understand preverbal trauma and use hypnotic age regression to bring the original experience to consciousness. We use other methods to access parts of the brain that store the imprint of the trauma and to bring closure to the nonverbal memory. The symptom picture is broader than that of post-traumatic stress disorder. Adult survivors report lifelong symptoms of anxiety with nervousness and spells of terror or panic. They may have temper outbursts, urges to smash or break things. They have depression, self-consciousness, distrust of others, and a high vulnerability to stress. Since these symptoms have been lifelong, therapists make the faulty conclusion that such clients have personality disorders. When it is recognized that these are persisting reactions from preverbal trauma, the way is opened for curative treatment.